Michael Gove.
Good afternoon and welcome to this number 10 press conference on our progress in the fight against COVID-19. I'm joined today by Professor Stephen Powis, the National Medical Director at NHS England. In a moment or two, I'll hand over to Steve to take us through the slide updates from the Cabinet Office briefing room. But first, I want to set out the latest coronavirus data. 1,206,405 tests for coronavirus have now been carried out in the UK, including 76,496 yesterday. Overall, 186,599 people have tested positive. That's an increase of 4,339 cases since yesterday. 14,248 people are currently being treated in hospital for coronavirus, compared to 14,695 yesterday. Sadly, of those who have tested positive for coronavirus across all settings, 28,446 have died. Behind the numbers, there's been an increase of 315 deaths since yesterday across all settings. This pandemic has claimed more than 28,000 lives, and each one of them is precious, each one valued, each one irreplaceable. The pain of bereavement and heartbreak is deeply personal. But as a society, we are showing care and compassion across boundaries, offering support and a chance to talk through grief together. And for those experiencing the first Ramadan without a loved one, this will be a particularly painful time. I send my sincere condolences to all families who are grieving. As with Christians, who could not celebrate Easter together in church, and the Jewish community, whose Passover rituals were affected by social distancing, our thoughts are with Muslim neighbours who cannot break their fast together and must adapt their religious and cultural practices because of the crisis. We have all learned to adapt, and we must carry on doing so after the Prime Minister sets out how we will get back to work later this week. His comprehensive plan will explain how we can get our economy moving, how we can get our children back to school, how we can travel to work more safely, and how we can make life in the workplace safer. But before we can ease the existing restrictions, we must ensure the government's 5 tests are met, that the number of cases are falling, that death rates are declining, that the NHS has what it needs, and that measures are in place to stop a second peak overwhelming the NHS. I'm particularly conscious that those in the front line of our public services will need clear guidance on safe working. They'll need the right personal protective equipment and appropriate access to testing if we are to make all the progress that we want in the weeks ahead. We're consulting with employers and unions, professionals and public health experts to establish how we can ensure that we have the safest possible working environments, and the Prime Minister will be saying more later this week. On personal protective equipment for key workers, we are increasing the spread of distribution and supply. From February the 25th to May the 2nd, we had delivered over 1.08 billion items of PPE across the health and social care system within England, and tens of millions more have been distributed by our colleagues in the devolved administrations. This overall figure includes 149 million masks, 173 million aprons, 2 million gowns, and 614 million gloves. On the 2nd of May alone, we delivered an additional 20 million items of PPE within England. But there is much more to do, and the work led by Lord Dayton to improve domestic production of PPE is vital to our efforts. And on testing, thanks to the hard work of so many across the NHS, Public Health England, our pharmaceutical sector and our universities, we have tested over 200,000 key workers and their families, allowing those who don't have the virus to go back to work and protecting those who do. We have now, of course, extended the criteria for testing beyond key workers to anyone over 65 displaying symptoms and anyone who has to travel to get to work. And this week, we will be piloting new test, track and trace procedures on the Isle of Wight, with a view to having them in place more widely later this month. All of these steps will help us to get more people back to work and help to support the delivery of our public services. And I want to thank those who've done so much to maintain the provision of critical public services during this crisis. Our teachers have worked incredibly hard to provide educational support to millions. And the government has committed £100 million to boost remote learning for those who need it most. Our newly launched Oak National Academy is supplementing all the work going on by schools and teachers by providing 180 video lessons each week. And we're particularly keen to help vulnerable and disadvantaged children carry on with their education during the pandemic. Schools continue to receive additional funding in the form of the pupil premium for those pupils who most deserve it, worth around £2.4 billion annually. And we've ordered laptops to help disadvantaged young people who will be sitting key exams next year. We're also providing laptops and tablets for those children with social workers and care leavers to help them stay in touch with the services they need, keeping them safe and supporting home learning. And if disadvantaged secondary school pupils and care leavers who are preparing for exams do not have internet access, we will provide free routers to get them connected while schools are closed. Over the Easter holidays, we were able to ensure that more than 60% of schools were open every day, with places for both vulnerable children and those of critical workers. And the free school meal voucher scheme ensured that children who needed it could continue to access food despite school closures. So far, 15,500 schools have placed orders for vouchers, of which over £35 million has been redeemed. The latest available data shows that around 49,000 of the children in attendance on April the 24th were classed by schools as vulnerable, more than double the figure from a week earlier. And while this is going in the right direction, we estimate this still represents only around 1 in 10 of all children and young people classified as vulnerable. We want to see this figure go up further, and we're working with local authorities, schools and colleges to provide improved support to vulnerable young people. All this additional support, of course, takes time, puts pressure on existing staff and costs money. That's why we've pledged an additional £1.6 billion to councils across England to support their essential frontline services, including adult social care. This sum takes the funding given to councils to over £3.2 billion to help communities through this crisis. We've also deployed military support to assist the public sector. The COVID support force, mobilised by the MOD, is now 20,000 strong. Today, over 3,600 personnel are deployed in support of 86 separate projects in which military aid is being given to civil authorities. On a national level, they're helping the Ministry of Housing, Communities and Local Government, the Department of Health and Social Care, and also the NHS, with planning and logistics in England, Scotland and Wales. On the ground, they're helping to build and to staff the temporary Nightingale hospitals and to operate both regional testing centres for coronavirus, of which there are now 49 around the country, and also the mobile testing units that we are rolling out. To date, there are 77 of them. Across the country, 156 military planners are embedded at grassroots level with our existing local resilience forums, partnerships of emergency services, local authorities, the NHS, the Environment Agency and others. They're helping to coordinate and to protect our vital local services and supplies with the additional support of senior Whitehall officials. In addition, we have to thank local government for their energetic work, because since the end of March, 90% of rough sleepers known to councils have been made an offer of accommodation, reassuring them about their safety. And the government more widely is also working hard to support those who have not been identified as shielded, but are still vulnerable. In the coming days, we'll be delivering our 1 millionth parcel of essential food to those at highest risk across the country. Up to 200,000 telephone calls a day are being made to the shielded, and councils are helping to support them in other ways, including organising regular calls from volunteers to those who are isolated. In our communities, the support put in place by many local organisations has been inspirational as people step up to help friends and neighbours, and the government has helped to mobilise another important lifeline through the NHS Volunteers Responders Programme. Over 600,000 people have had their ID verified and are helping with the daily errands that make such a significant difference, collecting shopping, making contact as a human voice on the end of a telephone, and transporting patients and supplies for the NHS. And of course, we are all working with supermarkets to ensure that a greater number of online delivery slots are made available to those most in need. In every one of these areas, the government in Westminster has been working with ministers from the Scottish Government, the Welsh Government and the Northern Ireland Executive. This has helped us to monitor and react to the path of the virus across the nations, enabling us to intervene wherever people are in need. At each of these daily press conferences, we've paid tribute to the compassion and dedication of our key public sector workers. I recognise how much we all owe to their stoicism and steadfastness. Nurses, doctors, porters, cleaners, paramedics, pharmacists, care home staff, prison and police officers, teachers, social workers, those preparing and delivering food, collecting our refuse and administering our welfare system. They deserve our gratitude, they deserve our support, they are in all our minds. They are the very best of us. We owe them so much, and we in government will do everything we can to support them during the next phases of our pandemic response. And I will now hand over to Professor Powis to take us through the latest developments on the pandemic.
Thank you and good afternoon. So if I may start by reminding everybody once again of the 5 tests the government has set for adjusting the lockdown. So these are shown here in the first slide. The first is that the NHS has sufficient capacity to provide critical care and specialist treatment right across the UK. And of course, I'm delighted that the NHS to date has been able to deal magnificently with the surge in coronavirus patients that we've seen, but that needs to continue, and we need to be confident that the same is true going forward into the months ahead. Secondly, that we see a sustained and consistent fall in daily deaths from coronavirus, and as I will show you later, that is indeed occurring now, although we need to make sure that it is sustained. Thirdly, that there is reliable data to show that the rate of infection is decreasing to manageable levels across the board. And although we are confident that we have seen a decrease in the spread of the virus in the community, we need to see the data and be sure of the data to know that that is indeed the case and can be sustained. Fourthly, that the operational challenges, some of which you have just heard about, including testing and PPE, are in hand and are in a position that will be able to meet future demand in the months ahead. And fifthly, confidence that any adjustments to the current social distancing measures do not risk a second peak of infection, a transmission rate that goes above R1, in other words, one person infecting on average more than one, because that will lead to a rise over time of the number of people who are infected and then increased pressure on the NHS once again. So those are the 5 tests. Now, as we have said many times, the British public has responded magnificently to the request of the government to comply with the social distancing measures. And in the next slide, we can give you some more data on the evidence that compliance has been high. And you can see here that in retail and recreation, in the workplace, in transit stations representing public transport, but also in other areas that we have seen a decline in the time people are spending in those settings. And I think this overall, as with other slides that we have shown you over the past weeks, shows that the public continues to respond to the request to keep social distancing measures, to comply, to protect the NHS and to save lives. Now, in the next slide, we show you the number of positive tests, of daily tests in the UK, and you will have heard a little bit about that again today. And you will see that testing capacity has ramped up very quickly over the last week or so, and we are now at a very high level of testing, over 100,000, a little bit of a dip in the weekend, but we anticipate that testing capacity will continue to increase, and it's a very important component of our approach going forward. In the next slide, you see how that translates into new cases, so that's test positive cases, and again you've seen an increase in recent days, and I think that reflects that we are now testing in more settings. We're able to let more people come forward for testing because testing capacity is ramped up. But the numbers have not increased dramatically, and I think that means even with more testing, it's evidence that the rate of infection in community is declining. In the next slide, you will see how that translates into people in hospital with COVID-19. And as I've said many times, this is a mild disease for the vast majority of people. but unfortunately for some, a hospital admission is required. And you can see that the peak of hospital admissions has now passed, particularly in London, where we saw the steepest rise, and we have now started to see the steepest fall. And since the middle of April, we have begun to see a decline in the overall number of people in hospital. And that again is evidence that the transmission rate of the virus in the community is falling, and that is translating into fewer people being admitted into hospital. And then on the next slide, that shows again how this translates into the usage of critical care beds. So these are our sickest patients. Again, a small minority, but nevertheless a very important group of people that have to receive care in intensive therapy units. And you can see once again, as a proportion, this has been declining since the middle of April. And indeed, if we looked at the absolute numbers, you would see a decline in absolute numbers too. So again, evidence that we are seeing the benefits of complying with social distancing measures and the reduction in transmission of the virus in the community is beginning to have an effect on fewer people in critical care. And then finally, the last two slides unfortunately represent those who have died. Of course, there are stories behind every single death, and our heart goes out to those loved ones who have suffered the loss of a relative or a friend. But you can see that on a 7-day rolling average, on these figures provided by Public Health England, Department of Health and devolved administrations, that the trend now is downwards. So it does appear that we are past the peak of deaths too, and we are beginning to see a decline in the number of deaths, which of course is good news and again represents the benefits of complying with social distancing. And then in the final slide, as we've shown before, an international comparison, now reporting UK deaths in all settings. Remember previously in these charts showing deaths, we were reporting for some time deaths in hospitals. This is now all settings. And again, the usual caveats with this, that different countries measure this differently. The measure that I think we all recognise will be the key measure is excess deaths for all mortality, because that will take into account the overall effect of the pandemic, but it will be some time before that sort of comparison can be done between countries. Thank you.
Thank you very much, Steve. Thank you. And we'll turn now to questions, and I believe that we have two questions from members of the public which have been submitted.
What lessons have you learned to prepare our health and care systems for the expected future waves of the virus? And how are you ensuring that we have adequate supplies of working ventilators and PPE for those expected future waves now?
Well, that question was from Chris in London. What lessons have we learned for future waves of the virus? How will we ensure that we have enough PPE and ventilators in the future? We're learning lessons all the time, as indeed the world is. This is a new virus, and scientists are working internationally to determine what the best means is of dealing with it. That's why we are piloting treatments which can prevent the virus, once people have been infected, becoming more dangerous for them. It's also why we're working internationally to seek to secure a vaccine, though of course we expect that may be some time away. But one of the things that we have learned is how to improve our testing capacity. We also now have increased domestic ventilator production, and Lord Dayton is increasing domestic PPE production as well. And I think the lessons that we're learning in the UK are similar to the lessons that other countries are learning as well. Steve?
Yes, well, as you've heard the Chief Medical Officer say at this podium, going forward, the intention will be to keep the transmission rate, the R value, below 1. That is one of the 5 tests set by the government for adjusting the lockdown, as I mentioned a few minutes ago. And if we can do that successfully, then we should protect ourselves against future waves of the virus. But having said that, nothing is ever certain, and it's absolutely the case that we need to go forward, putting in place the measures within the NHS to ensure that if for whatever reason we do see future waves, that we can cope with this. And I think the lesson that I've learned is that the NHS is able to behave incredibly flexibly, incredibly agile, and surge its capacity at very short notice. If you go back only a month or two, when we were at the start of this, the NHS was planning on how we could manage an increase in the number of cases of people with COVID-19. And at that time, remember, we were seeing health systems in other parts of the world becoming overwhelmed. So you will remember the pictures from Wuhan in China at the very start of this in January. You will remember the images we saw from northern Italy when that health system became overwhelmed and patients had to be flown to other countries. And you will remember seeing images in closer countries, France, of patients having to be moved out of major urban centres such as Paris. And so what I learned is that the NHS and the great staff of the NHS, when given that challenge, can very, very rapidly put in place the extra capacity that is required. And they have done that magnificently, and at no point during the surge of cases in April was the NHS in a position where it was not able to give the treatment to patients with COVID-19 that they needed. That is a great testament to how well the NHS has been able to cope. And I think then the lesson going forward is one, that we can do that, but two, we need to keep that capacity in place. But we need to keep it in place at the same time as standing up all the other services that the NHS is providing. The ones we've always provided, the emergency services, but some of the services that we've had to stand down during April, so elective surgery, for instance. So my lesson is that the NHS is incredibly flexible. It can respond to this challenge, and it will respond to the challenge going forward into the months ahead.
Thank you, Steve. Thank you. And we'll turn to the next question submitted from the public. Rebecca from Scotland asks, we see daily charts showing the quantifiable scientific effects of lockdown. How are you taking into account the unquantifiable, non-scientific social and emotional effects when considering the balance between benefit and damage caused by lockdown? Well, Rebecca, we're seeking all the time to make sure that we balance the need to protect life, to protect the NHS, with an acknowledgement, you're right, that lockdown will have an impact on the mental and emotional well-being of so many of our citizens. And of course, by suppressing economic activity, it also means that the wealth the country needs in order to ensure that we have high-quality public services is affected as well. But the 5 tests that have been laid down, and which Steve reminded us of earlier, are a very good way of making sure that we can make an appropriate judgment. Because the worst thing to do would be to prematurely relax the current measures, to see a second spike which might risk overwhelming the NHS and which would compel us to introduce lockdown measures all over again. That would be the most dangerous course, I think, for us to take. Steve?
Yes, so as a doctor, I am very aware that the measures that we have had to ask people to comply with, the stay at home, the avoid social contact, can have detrimental effects in terms of health, but also emotional and social effects, as you have asked in your question. And we are very keen, as are all my clinical and scientific colleagues, to make sure that as soon as we possibly can, we are able to give advice that allows those measures to be relaxed. As you have heard a number of times, the harm that might be done in terms of health as a direct effect of the virus, deaths due to the virus, has to be balanced off over time against the harm that is done around lockdown. And it's not easy. Those are two things that it's not easy to reconcile. But I can say that we are very, very aware of the effects that lockdown has, both socially, emotionally, and on health. And that's why plotting a way ahead that allows over time those restrictions to be lifted, while at the same time keeping the transmission rate low in the community, is absolutely the goal that we are working towards.
Thanks, Steve. Thank you. We'll turn now to questions from representatives of news organisations, and the first is from Chris Mason of the BBC. Chris.
Hello, good afternoon to you both. Mr Gove, as the lockdown measures begin to ease, how is the government going to persuade people that it is safe to be out and about more? And Professor Powis, how confident are you in the models that predict what impact a particular change in the rules might actually have?
Well, thank you, Chris. You're absolutely right. The British public have shown amazing stoicism and understanding of the need for the lockdown measures. And quite rightly, they want to ensure that if and when they are eased, that they're eased in a way that makes sure that the British people's sacrifice has been worthwhile, and that we continue to operate in a way which means that public health comes first. And that's why it's so important that we consult with employers and with trade unions in order to make sure that people understand the guidance about working safely. It's also important that we make clear that any approach that we take is staged, that we're not, as the First Minister of Scotland said, flicking a switch and going from one situation back to the old normal. Our phased approach is one which allows us to monitor the impact that those changes are having on public health, and if necessary, in a specific and localised way. That means that we can pause or even reintroduce those restrictions that might be required in order to deal with localised outbreaks of the disease. And of course, it's also important that we make sure that people have as well as the right guidance and the right safe working environment, the right personal protective equipment as well. And that will vary from setting to setting. The type of PPE that you will need if you're operating in intensive care is different from the type of PPE that you might require in another public sector setting. And then the final thing is Matt Hancock's amazing success in increasing testing means that people can have greater confidence, along with the development of the test, track and trace approach that's being piloted in the Isle of Wight, that we will be able to make sure that people who are suffering from the virus they and their contacts can be encouraged to stay at home so that we can limit the potential of any outbreak. But I'll hand over to Steve.
Yeah, so on the modelling, I think, Chris, obviously the first point to make is that modelling is just that. It is a process of taking a set of assumptions, a set of knowns, and predicting what will happen in the future. And the reality will always be different from the model. It will not be exactly replicate the model. And sometimes some of the assumptions you can't be certain about, and there are some unknowns when you model. So having said that, right at the start of this, a reasonable worst-case scenario model was produced by the government, or for the government, which predicted what would happen if no measures were taken to prevent or to mitigate or to reduce the level of transmission in the community. Of course, no country has actually stood aside and not put in place some form of social distancing measures. So we will not, we won't know what that would have been against that model, because everybody has put in a set of measures that has meant that that didn't happen. Once the lockdown measures were in place, other models were produced that took into account the predicted compliance of the public with those lockdown measures. And as I've said, you've heard before, the British public have been really excellent at complying with those. And in fact, what we have seen, certainly in the NHS, in terms of the predictions, those sorts of model, and the models come from a variety of academic groups working together, has predicted in terms of bed numbers, bed usage, has actually, the reality has actually followed the shape of those predictions. It never follows it perfectly in absolute numbers, but it's followed it pretty much in the shape of what we've seen. So that does give me some confidence that going forward, that models are a reasonable way of predicting what we might see. And they do predict that over the next month or so, we will continue to see a decline in the number of patients in hospital with COVID-19, the number of people on critical care, and indeed the number of deaths. And of course, that is what we are seeing in reality. Clearly, we will need to do more modelling. Clearly, it's important that various academic groups feed into those models. That is right and proper. That is what SAGE and the modelling groups do. They will never be an absolute perfect prediction of reality, but I have confidence that going forward, they will give us a very good guide of what we are likely to see.
Thank you very much. Was that okay, Chris? Is there anything you wanted to follow up on where you wanted just further elucidation?
Very quick follow-up with you, Mr. Gove. We've got very used to the mantra plastered across the lecterns you're stood behind. Can we expect a more subtle message to come in the next phase to mirror what could be a more subtle, a more nuanced set of rules?
Well, I think you're right that the message has been taken to the heart of the British people. What we need to do, I think, is just to make sure that the on-the-ground advice that we give is sufficiently reassuring. I think it's about making sure that people feel that the pointers that we're giving about how a workplace can be safe are sensible, reliable, supported by employers and trade unions. I think, myself, that's the most important thing. And I'll turn now to Dan Hewitt of ITV.
Hello, sorry about that. I had to unmute myself.
Sorry.
Good afternoon to both of you. First of all, on the NHS contact tracing app that's been trialled in the Isle of Wight this week, given you need 50 to 60% of the entire population to download this app once it's up and running, how crucial, how central will it be to the government's policy of suppressing the virus, and how much will it dictate going forward the measures you have put in place or lift in terms of the lockdown? And secondly, on testing, we've seen the number fall to 76,000 or so. How do you account for that sharp fall in just 24 hours? And how concerned are you by the fall of almost 30,000 tests?
Well, thank you, Dan. On the first, you're absolutely right that when it comes to contact tracing, the more people who download the app that's been developed by the NHS, the better. There are some 80,000 households on the Isle of Wight, and obviously we'd like to see more than half of households, if we can, sign up to the app. But it's striking, and it refers back obviously to the points that Chris Mason made, how public-spirited people have been throughout this crisis, and knowing that this is a contribution that all of us can make to helping to keep our neighbours and our communities safer, I think, is a very, very powerful incentive. And the leader of the Isle of Wight Council and the Isle of Wight's MP, the excellent Bob Seeley, have both said that they believe that it's in the interests of the island and of the country that as many people as possible sign up to the app. On the point about testing, it is the case that you might expect over a weekend, particularly over a Saturday, with fewer people going to work, that you might have a dip in the amount of testing that might occur at that time. But again, I don't think it in any way detracts from the amazing achievement of the NHS and of others in so significantly increasing the amount of tests that are available. Steve.
Yes, so on the app, I think you're absolutely right. It is one component of a number. It's likely to be one component of a number of measures that will be needed. I would think it's unlikely that on its own it is going to be the single measure or the single intervention that will ensure that the virus is always under control. There will need to be contact tracing in the way we've always done contact tracing, so people following leads as to who you've contacted. That's exactly why Public Health England are recruiting many thousands of people to help with contact tracing. And it will need to sit aside other measures that we have become used to, such as if you are symptomatic and if you have the virus and if you test positive, you will need to stay at home for a period. So it is one component. The more people who download it and use it, the bigger contribution it will make, but it will not, I doubt, be the single contribution. And of course, testing it will help us to understand before it is deployed exactly what that contribution is likely to be. So the testing in the Isle of Wight is a very important phase in understanding how the app is going to be used and exactly what the contribution will be.
Thanks, Dan. Did you want to come back on anything there?
Only on the app. What evidence do you have maybe from other countries or the research you've done so far that suggests this could actually work? Because clearly it's very new. So I got the sense from Professor Powis that you're not overly reliant on this.
Well, again, Professor Powis underlined the point that it's one arrow in the quiver, but it is the case that other countries, Germany and France, are developing apps as well, and we want to make sure that they're interoperable. The fact that other developed nations and our European friends and partners are going down this route, I think only underlines how wise NHSX was to invest in and to lead on this technology. But Steve, I don't know if there's any more.
Yes, other countries are developing or using apps. Not everybody has deployed one, so you're absolutely right. There will be international learning as we go forward as to when these apps are deployed. In some of the Far Eastern countries, they have been used successfully. So there is evidence that they can be used as part of a series of measures. But I think even in those countries, such as Singapore and other countries, again, it is a suite of measures. It is not a single measure. So we will learn some of that as we test and as we roll it out. And I think the other important point to make is that this will never be about a single set of measures that you freeze and then don't change over time. I think measures will always need to be reviewed and adjusted based on what the infection is doing and what the reality of the situation is. But the app will be an important component of that going forward.
Thanks, Steve. Thank you. And we'll turn now to Inigo Gilmore from Channel 4 News. Inigo.
Mr. Gove, do you agree with your Transport Secretary that had mass testing been in place sooner, many lives could have been saved? And Mr. Gove, you keep telling us you're on top of the PPE issue once again today, but a BMA report out today said that half of doctors had to source their own PPE because the government failed to do so. What would you say to the families of frontline NHS workers who've died without being provided with the proper protective equipment that they needed?
Well, thank you, Inigo. On the first point about testing, again, I think there will be a time when we've got this virus under control, when we can ask ourselves some deep and probing questions about lessons that we can learn as a country from how we handled this virus in its early stages. I would just say that the amazing achievement of Matt Hancock, Jim Bethell, our NHS and others in ensuring that we can increase the number of tests has been, I think, an example of what the public sector and the private sector working together under very strong political leadership can achieve. But of course, we will have an opportunity in due course to look back and to reflect and to consider what it is that we got right and what it is that we got wrong. Undoubtedly, this government, like all governments, will have made mistakes, but it will be impossible to determine exactly which were the areas of gravest concern until sometime in the future when we have all the information that we need. On PPE, I would never say that we were on top. I would always say that we were doing everything that we can. And it's naturally of concern to any of us if people on the front line don't have the right personal protective equipment. But it is the case, as you'll be aware, that the BMA does an excellent job, principally but not exclusively, in representing people on in primary care, GPs and so on. And it has been the case in the past that for those in general practice, that they will have been sourcing quite a lot of their own equipment themselves in any case. But of course, we want to make sure that we do everything at an NHS level and beyond to support everyone who does have the right personal protective equipment. And again, there will be an opportunity in due course to look back and to see what we've got right and what we haven't got right when it comes to making sure that frontline workers get everything that they need. In the meantime, though, all our focus is on making sure that we can do as well as possible in supporting people who are putting everything on the line to look after us. So I hope that's helpful, but you may want to follow up.
There have been failings over PPE, and what are you saying to the families who's lost their loved ones, frontline NHS workers?
Well, every death is a tragedy, and we want to make sure that we do everything that we can to support those who are on the front line in the NHS. There will, as I say, be a moment when we can reflect on what might have been done better. In the meantime, what we must do is to make sure, as Lord Dayton is doing, as the Department of Health is doing, as every arm of government is doing, that we use all of the tools at our disposal to increase production of the gowns, aprons, gloves, visors, and other equipment that people on the front line need. Of course, it is important to recognise, and I know you do, that the range of personal protective equipment that might be needed in one setting will be different from another. But Steve, you may want to say a little bit more.
Well, on PPE, obviously as a doctor who worked on the front line for many, many years, I've said before and I'll say again, I know how critical it is that PPE is provided to my colleagues, my friends, on the front line. I know that has been a challenge. I know government has been working very, very hard. I know that it's an international market that is under significant stress as every country tries to purchase PPE. A couple of weeks ago, I know I was concerned about gowns. The position on gowns actually has improved a bit over the last couple of weeks. So depending upon the item of PPE, things will improve over time. But it is a challenge for exactly the reasons that we said. But it is absolutely critical, as you said, that government stays on top of that challenge and PPE is provided to frontline staff.
Yes, and Steve is right. It is. It doesn't take away from the responsibility of any of us in government, but it is a global challenge. And Channel 4 News viewers and others will have seen some of the protests in other countries, in France and Germany, as doctors there have complained about the lack of PPE. As I say, that doesn't take away for a second from our responsibility to do even better, but it does mean I think that people recognise that this is a global challenge. Chris Hope of The Telegraph.
Hi, Mr. Gove. May I ask you, Grant Shapps today talked of one-way systems in stations and staggered starts to the working day. When will daily life return to what we knew before the pandemic struck? How many years might it take? Let me just ask quickly, Professor Powis, Nightingale hospitals are empty. Were they built in error or to be filled with a second wave? Just a couple of quick ones. What is the virus's R value today? What was the exact date last week? And what the exact time when the UK passed through the peak?
That's four very important questions, Chris. On the first one, about when can we return to normal, I think people have used the phrase a new normal, and by that I think what they've sought to imply is that we can begin, we hope, as you quite rightly point out, as the R0 figure comes down, to ease some of the restrictions, but we have to do so in a cautious fashion. And the Transport Secretary was right to say that we can begin to see perhaps more people use public transport, but provided they are helped to stagger or to control the times when they use public transport in the way that people have already adjusted to how they might use supermarkets and food shops and so on. Ultimately, unless and until we have a vaccine, then I suspect that we're going to have to live with some degree of constraint because of the nature of the virus, but we obviously want to, wherever possible and consistent with our measures on public health, restore people's lives to as close to normal as possible. But you asked three detailed technical questions, which Steve may be able to answer, but they're so precise, I think that they may elude any capacity for any scientist or doctor to answer precisely.
Well, I'll give it a go. So on the first, on how long will the new normal need to last? As you might expect, that's an answer that none of us can give at the moment. If I remind you and everybody that this is a virus that at the end of last year was not known, had not been in the human population, and therefore the population around the world was not immune to it. So we're only really 4 months into any knowledge at all about this virus, and it's really difficult to know how this is going to play out in the months and years ahead. But a few things I think I can be certain about. Firstly, is that the scientific response to this virus has probably been the greatest to any new virus. The fact that it was sequenced, its genetic sequence was known within weeks of it being identified, as mean that the science can accelerate very quickly, including the ability to produce vaccines and start to test them. And also, of course, to start to use drugs and to understand which drugs it is likely will bind to either the virus or parts of the body's machinery that the virus itself affects. So that means that we can proceed with a pace that's probably, well, I'm certain has not been the case in any other previous pandemic. So that gives us hope that we might get to a solution, whether it's a vaccine or indeed whether it's drugs, sooner than we might have hoped 10, 20 years ago. But it's impossible to say when that will be, but it's certainly true to say that we will need to adapt to a new normal until we get to that point. On the second question, which was were the Nightingales built in error? Absolutely 100% not. And if you remember, I was talking a little bit earlier in response to another question, that if you wind the clock back a month or two, we were looking at an increase in the number of cases, infections in the UK. We were watching images from around the world of health systems that were overwhelmed. And we had not put in place, or we were about to put in place, a series of social distancing measures, not absolutely knowing how the public would respond to that. And it would have been foolish to have not planned for extra capacity within the NHS. We did that in a number of ways, including the Nightingales. The fact that we have not needed to use all that capacity is actually good news, because it means that the public have complied with the social distancing measures. They have started to flatten that curve, and we've seen fewer admissions and ultimately fewer deaths than we might have seen if this virus had just been left to spread unchecked. And the very early worst case scenarios that, as I said, no country has let play out would have meant many, many, many deaths and an awful lot of pressure on health services. So I think you would be 1,000 times more critical if the NHS had not put in that extra capacity and had become overwhelmed. You would be quite rightly asking us why we had not gone every mile that we could possibly go to put in that extra capacity. So the Nightingales were not built in error, and we may still need them. We are not through this yet, and although government policy and the scientific advice is to try and ensure that the virus does not start to spread widely again, we can never absolutely be certain, and therefore for the months ahead we need to maintain that extra capacity until we have more certainty. And then thirdly, on when was the peak, so I think that's a question that can't really be precisely answered, as you've heard, because firstly there's been a series of peaks. There's been peaks in deaths, peaks in hospital admissions, and peaks have occurred at different times during around the country because different regions of the country have been in different stages. But as you saw from the slides presented at the start, most of the measures that we are looking at started to reduce from around the middle of April. So I think broadly we saw that plateauing of a variety of measures around the middle of April.
Thanks very much. Thanks, Steve. And we'll turn now to Sienna. Oh, sorry, Chris, you wanted to come back. Forgive me.
I asked what the R value was today. Sorry.
Oh, yes.
Yes. So again, sorry, you did. That was a fourth. I think Sir Patrick Vallance has said that, and the Chief Medical Officer, that they believe the R value is around 0.7. We are measuring that directly at the moment through the work of the Office for National Statistics. I think that's being measured by randomly testing people in the community. Once that data has been presented to us, once that data is available, I think it will be better to give a more precise figure. But I think, as Patrick also explained, I think it's really impossible to come with an absolute single precise number, because throughout the country in different settings it will be slightly different. So I think you will always see a range, but with better data that range will narrow.
Thank you very much, Steve. Thank you. Thanks, Chris. And we'll turn now to Sienna Rogers from Labour List.
Hi. 1 month ago, the government announced a scheme to release low-risk prisoners, and it was expected that up to 4,000 would be released. But after mistakes were made, the scheme was paused. So, Mr. Gove, can you tell us how many risk-assessed prisoners in total and how many pregnant prisoners have now been released? And Professor Powis, rates of self-harm in English and Welsh prisons were up 14% last year. So with visits cancelled at the moment, are you concerned about the well-being of people in cells 23 hours a day?
Well, thank you, Sienna. Thank you. With respect to the early release of prisoners, the Lord Chancellor and his team developed a package of which the early release of prisoners was just one part, in order to make sure that we could restrict the spread of the virus within the prison estate. And the reason for that was to reduce the number of cases from the prison estate, which would be in our NHS. So our principal aim, as always, was to protect the NHS. And there were a number of changes that the Lord Chancellor made to the prison system in order to increase capacity, including cohorting within particular prisons and restrictions on the transfer of prisoners. But one part of it, as you quite rightly point out, was the ability in specific circumstances to release some prisoners early. And a set of tests were applied. It needed to be the case that their first offence, their index offence, was of a particular kind so that they did not pose a risk to the public. And it needed to be the case that they were close to the time when they would have been released anyway. And as you quite rightly point out, the prisoners at the front of the queue were those pregnant women who found themselves in prison. I know that there were at least 33 people who had been released. I think the number is higher than that now, but after this press conference I'll of course talk to the Ministry of Justice and make sure that you have the accurate figures, but as I say, I think it was around 33 who had been released this time last week. I think those were the confirmed figures, but we will get the absolutely accurate figures for you, and I'll hand over to Steve.
Yes, so on prison health in general, so I absolutely believe that we should always be doing as much as we possibly can to support prison health. In fact, about this time last year, I spent a morning in a prison in the north of England looking at prison health services, and I was incredibly impressed with the dedication of the staff within the prison, but also staff and general practitioners coming in from outside to provide support. And clearly, at a time of crisis, a time of emergency such as the coronavirus, it's really important that we we place an additional focus on ensuring that prison health is responding. At the same time, it's important to ensure that we maintain safety and we reduce the chance of outbreaks and spread of COVID. But that's a very important balance, and it mirrors the balance in one sense in the community that was the subject of one of the previous questions as to how you balance between the sort of measures you might need to put in place to stop spread of the virus versus ensuring that the potential downsides of that are adequately managed as well. So yes, I do think it's incredibly important that we do that.
Thank you very much, Steve. Sienna, was there any particular point you wanted to follow up on? Sorry.
Yes, please. I just wanted to ask, what are you doing right now to prepare for the spike in prison population that's expected when restrictions are lifted and normal court activities get going again?
Well, you are right that at the moment the throughput from our courts into our prisons has been lower, and that's helped us to manage the situation in prison. And we're, during the course of this week, we'll be looking in the Ministerial Implementation Group, which I chair, at both how we can make sure that there are more criminal cases which are appropriately heard, and also how we can ensure that the prison estate can manage. One part of that is making sure that we have access to additional facilities, and I think it's the case that a former secure training centre for young offenders in Medway has been made available to the prison estate, but it's also the case that the prison estate is working with the MOD and others to make sure that there are sufficient spaces as and when, as you quite rightly point out, more criminal cases are heard. I'll turn now to Ahmed Versi from the Muslim News. Ahmed.
Hi, good afternoon. I would like to, I understand that both NHS England and Public Health England have got an inquiry into the disproportionate impact on the COVID-19 on the BAME communities. I would like to know what are the terms of reference for this inquiry and the names of the members of this inquiry. And secondly, why is it that whenever questions are asked regarding this impact of COVID-19 more disproportionately on the BAME communities, the answer we always get is to do with biological reasons. We might talk about because of the high preponderance of diabetes, heart conditions, and so on. Don't you think there are more structural issues like racism and discrimination that that's in the community and as well as in the national health?
Well, I think those are very powerful questions and challenges, Ahmed. The work that's going on to look at the what appears to be a significant additional number of deaths amongst the BAME population is being conducted by a variety of people in the NHS, Public Health England, and of course we're being supported by Sir Trevor Phillips and others in looking at those figures. And it is the case, of course, that you need to look at these things, as you fully appreciate, in the round. It may be the case that amongst some minority populations there is, as you indicate with the reference to diabetes, a greater prevalence of comorbidities. That may be a factor, but it may also be the factor that, as we know, inequality can contribute to public health outcomes, and it may be that we need to take a step back and look more broadly at some of the inequalities that exist within our society. But I certainly wouldn't want to prejudge that question, and certainly I know that Steve knows far more about these questions than I do from a scientific point of view. Steve?
Yeah, so it's an incredibly important question or set of questions. So the investigation is being undertaken by Public Health England. We at NHS England don't have the core experience or the experts in the particular work areas that need to look at this. That is an area where Public Health England has the expertise. We will, of course, support Public Health England, but the Chief Medical Officer has asked Public Health England to look at that. I haven't got a full list of the names of people who will be involved in that, but I'm sure that will be available. As you have said, it is possible that some of the underlying conditions that are associated or are a higher prevalence in certain ethnic groups might be important. because they are also risk factors that mean it's more likely to either get the virus or to suffer the complications. But as you quite rightly said, that might not be the only reason. And it's really important that that Public Health England and colleagues who are working on this go in with an open mind and look at all the possible causes. Biological causes may well be one part, but it's important that it's looked at in the round. I absolutely agree with you there.
Thank you very much, Steve. Ahmad, did you want to follow up?
Yeah, you mentioned Trevor Phillips. There's two issues here. One is he recently said that the death rates from the Pakistani and Bangladeshi communities was not significantly higher than the general population. However, all the reports that I have read shows that the Pakistani and Bangladeshi communities are actually are very much a higher rate of deaths than the general population. And the reason that he gave, which is very surprising, is that because they are doing ritual ablutions. What kind of a person that you are employing makes that kind of conclusion?
Well, I'm not aware of those comments, but I do know that Trevor Phillips, as chair of the Equalities and Human Rights Commission, was always someone who was driven by the data, and Public Health England would do nothing else other than follow the data in coming to appropriate conclusions. And of course, we do need to look at, as we discussed earlier, and as Steve mentioned, potentially some biological factors, but also, as your question implied, also perhaps some socioeconomic or structural factors which may lead to inequality, and that inequality may have been as a result of discrimination. But we need to look at all these things proportionately, and I think anyone who's prepared to give their time, who is a distinguished public servant like Trevor Phillips, to help us in this endeavour, is someone whose support we welcome. So thank you very much. That's the end of this press conference, and I look forward to one of my colleagues joining you at the podium tomorrow. Thank you.
So Michael Gove there, bringing to an end the latest Downing Street coronavirus briefing. Let's just remind you of some of the main points from that press conference, which has just finished. Well, Mr. Gove told us that yesterday more than 315 people had died with coronavirus in hospitals, care homes and in the wider community. This means that a total of 28,446 people had died after testing positive for coronavirus in the UK, and that's as of 5 p.m. yesterday. On the issue of testing, Mr. Gove said that 76,496 coronavirus tests have been carried out in the UK on Saturday. And announcing efforts to help with the future lifting of the lockdown, he said that the government will be trialling new test, track and trace procedures on the Isle of Wight next week, ahead of offering it more widely later this month. Well, our health correspondent Richard Galpin has been listening to all of that. Richard, quite a lot of information, as there always is. Just let's take a look at a slightly closer look at the statistics that we heard in terms of the figures that we've heard.
Yeah, I mean, the broad picture which was spelt out is that, in all the major areas, infections, deaths, etc., the numbers are broadly coming down, albeit slowly, but there's still some very high numbers. For example, if you look at the number of people who've tested positive, it's 186,000 people. So it's a very large number of people, and obviously concerns about leading to further deaths, etc., when you have this number of cases. And as you're saying, we now have more than 28,500 roughly people who have died. That number is edging closer and closer to Italy. And I know obviously we can't necessarily compare these, it's obviously problematic, but it could look like that Britain will move forward to be have the highest number of deaths in Europe. We don't know that obviously yet, but that is looking like a possibility. On the positive side, for example, the number of people in hospitals is going down and down. It's now down to 14,200. At the peak, it was something like 18,000. So those numbers are coming down significantly, and obviously that's very important indeed.
So on the issue of testing, I suppose it's worth pointing out that many more people are being tested, aren't they? So if more people are showing positive for testing, Some might say that's as a result of more people being tested.
Yes, and obviously it's a very good thing, is that testing is now really significantly underway, very significant numbers, although it's down a bit now, isn't it, from about 100,000 at the end of last week. It's now down to about 76,000, but that was explained during the press conference as potentially being because of the weekend, when things do tend to lag.
What else stood out for you in the briefing there?
Well, there was a very good question. When they were saying, how can you convince people that it's going to be safe to come out of lockdown as and when that does actually happen? And Michael Gove gave a pretty long answer to it. I mean, obviously focusing on the need to be safe in doing this, that's absolutely the number one priority. But he was saying that they would be consulting with employers and trade unions, and he's saying it must be a phased approach so that you can monitor the impact of changes, and if necessary, reimpose some lockdown measures in a localised way. And that presumably would imply maybe different regions, different cities, different towns, not quite sure what level that would go to, but he is talking about differentials between different parts of the country potentially if infections start rising in particular areas because of the lifting of the lockdown.
And that is, I think, the first time we've heard a Cabinet Minister talk about measures being used in a localised way. And he used the word twice, didn't he?
Absolutely, no. So I think you're absolutely right. I think this is significant. Maybe we were seeing a bit more of the government's thinking that this is the way to be able to move forward, that not, very large parts of the country can move on, but, and then if necessary, other parts where there are problems, then they can be dealt with in this localised way. So it doesn't affect everybody in the country, because we've now been in lockdown for quite a long time, and it's obviously has potentially very serious impacts on people's lives in many, many different ways.
Well, we are, as you say, about to enter, I think, the 7th week of lockdown. This is an important week coming up, isn't it?
Yes, because we're waiting for this grand plan from the Prime Minister, Boris Johnson. We think that's obviously will take this week, because they're coming to this deadline on May the 7th, which is when they have to review the lockdown measures. Once again, they have to do it every 3 weeks or so. So we're waiting for this really crunch announcement from the Prime Minister about how things could gradually be lifted, or how they could be eased. And he's talking about, this certainly Michael Gove was saying that this would be about how you get the economy going again, how you get the economy moving, how you get children back into schools, how to get workers into work, because obviously transport is an issue. So how to get transport up and running so that people can get to work, and that can be how that can be done safely. And then also people, once they're in work, that they can actually be in work in a safe environment.
So many questions, so many issues to be dealt with. Richard, many thanks. Our health correspondent Richard Galpin there.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.